So, hi everyone, I'm Sally. I'm a consultant in health protection. I'm joined today by Ed, who's a senior health protection practitioner. We are from the London Health Protection team at the UK Health Security Agency, and we're here to talk to you about hepatitis A and B and a few other things as well.
Hi everyone. So I'll start by talking about who are the London Health Protection teams. So there are two health protection teams, or HPTs, in London, North London and South London. Health protection teams, we receive notifications from GPs, hospitals and laboratories about cases of infectious disease. We work closely with health services, local authorities and communities to arrange follow-up of cases and outbreaks of the more serious infectious illnesses. This can involve giving information and advice, arranging post-exposure vaccinations or antibiotics, or requiring people to stay away from work or school.
So we're here to talk about hepatitis A and B, but there are other types of hepatitis. So hepatitis means inflammation of the liver. There are 5 types. So just to touch briefly on the other 3, they are passed on in different ways and they have different treatments and prevention. So Hep C is passed on blood to blood. Complications can be serious. There's no vaccine, but it's easily treated. Hepatitis D is only caught in those who have or who've had hepatitis B infection, and that increases the risk of complications. Hepatitis E is rarer in the UK. It's passed on in food and water. People usually recover quite quickly from it, although it's more serious in some groups, such as pregnancy.
So I'm going to talk about hepatitis A, which is sometimes called Hep A or HAV. It's usually passed on through contaminated food and water, and it's mostly acquired overseas, although there has been a recent increase in people in the UK who haven't travelled abroad. We sometimes see spread from person to person in households or in schools and nurseries, and only around 1 in 5 adults in the UK have immunity against it, either from vaccination or past infection. Symptoms of hepatitis A include tiredness, nausea, vomiting, abdominal pain, and around 3/4 of cases will have jaundice, which is a yellowing of the eyes or skin. Children often have a milder illness or no symptoms at all, but are still infectious. And it's common for people to need admission to hospital. The need rises with age, and around 50% of adults will need hospital admission of 2 days or more. People are infectious before they feel unwell, around 2 weeks before they start feeling unwell, until 1 week after jaundice starts. But most people will make a full recovery without medical treatment. So there's around 150 million cases of hepatitis A every year globally. Certain countries have hepatitis A circulating wildly, and you can see those on the map here in the reds and oranges, which is mainly the Indian subcontinent and Central Africa and parts of Asia. In the UK, the majority of cases we see have travelled to endemic countries. Many are people who were born in these areas and go back frequently, often without getting travel vaccines. And then in the UK, there are around 250 to 500 Hep A infections confirmed each year. But there was a notable increase in 2024 with nearly 900 cases in England, of which over a quarter were in London, which you can see in the light green on the pie chart in the bottom right there. So there are certain people who are more likely to become severely unwell if they catch hepatitis A. These are people with chronic liver disease, including hepatitis B or C, people with immunosuppression, some people who are HIV positive, and people over 60 years old. Our work involves additional public health actions for anyone in these groups who's exposed to hepatitis A. So a bit on vaccination and travel advice. There is a safe and effective vaccine against hepatitis A. It's not part of routine immunisation, but it is offered as a travel vaccine. It's particularly important for those who are born in or their families from regions where Hep A is common. The vaccine is free on the NHS, and many but not all GP practices offer it as a travel vaccine. It's also available from private travel clinics, but these will charge for it. It's best to get vaccines 6 to 8 weeks before travel, but it's still worth having a travel appointment at any point before departure. And this can also check for what other travel vaccines are needed, including things like typhoid fever. So there are some similarities in how Hep A is spread with other food poisoning illnesses. So this is some general advice. For anyone with diarrhea and vomiting, they should not attend work or school until at least 2 days after they have fully recovered. There are some infections where people should stay away from work longer if they have certain jobs, e.g. working with food, looking after young children, or working with vulnerable people. But health protection teams will contact them directly to give that advice. For any infections involving diarrhea and/or vomiting, the most important thing is keeping good hygiene, particularly hand hygiene, after using the bathroom and before eating or preparing food. Unless unavoidable, don't cook for others when ill. And when travelling abroad, always remember to follow food and water hygiene guidance.
Thanks, Ed. So I'm going to move over to talk about hepatitis B. This affects millions of people around the world. It's different to Hep A in that it's passed on by blood-to-blood contact, for example, sexual contact, or through needle stick injuries. Globally, mother-to-child transmission is the main way the infection is passed on, so either during pregnancy or around the time of birth, although in the UK we have a programme to prevent this. Infections can be cleared from the body, or they can go on to become chronic. In chronic cases, you get chronic inflammation, which can scar the liver. That can lead to liver failure and cancer in some cases. The good news is that we have a very effective vaccine, and although there's currently no treatment cure, there is treatment to control it. Another map here, this map shows how the rates of hepatitis B infection are distributed globally. You can see areas in the kind of reds and oranges in Africa and Asia are the areas most affected by Hep B. Detecting hepatitis B early means it can be treated quicker and reduces the chances of serious complications. So consider testing in anyone with symptoms of hepatitis B. So they're similar to those described by Ed earlier. They can be a bit vague, flu-like symptoms, but also tummy pain and that yellowing of the skin and eyes. We'd also consider testing in those who've been exposed to the virus or think they might have been, for example, if they're from a country where hepatitis B is more common. And it's offered as a test to all pregnant people in the UK. We've got a really effective vaccine that works very well and is safe and stops children and adults getting hepatitis B given to some groups. So babies, since 2017, babies born after that point are offered it in their routine childhood immunisation. So it's really important to make sure that children are up to date with their IMS. Babies born to mums who've got Hep B infection themselves will get it. They'll get extra vaccines, some tests, and sometimes some treatments. We also offer it to people who are higher risk of getting the infection, so close contacts living around someone with the infection, those whose work increases their likelihood of exposure, for example, healthcare workers. And if you're travelling to areas with high Hep B rates, you can take the vaccine, although you may have to pay for it. We also vaccinate those who've recently been exposed to the infection, for example, sexually or through an accident. And we vaccinate people who have chronic conditions that might mean they get very ill if they're exposed to hepatitis B. And just some final notes on living with hepatitis B. It's one of the commonest viral infections globally, so anyone with it is not alone. However somebody gets their infection, it's not their fault. People living with hepatitis B can have children, they can have a normal family life. The vaccination stops the virus being passed on. And people living with Hep B can enjoy meals with friends and hug loved ones. The virus can't be passed on in those ways. It can be treated and controlled.
And we just have one slide on measles. So there was a large measles outbreak in England in 2024, with most cases in London. Cases decreased at the end of the year, but as of
Oh, have we lost Ed?
April 2025, they have started rising. It typically affects children and younger adults. Around 20 to 40% of people will be hospitalised. Complications can include deafness, blindness, and in rare cases, death. There is a safe and effective vaccine against measles called the MMR. It also offers protection against mumps and rubella. MMR is offered by GP practices, and there's no upper age limit to receive it. And if people are unsure if they've had the recommended 2 doses, there's no harm caused by having.
Sally, I'm not sure if you can jump in there because I think Ed keeps cutting out.
Yeah, I think I heard him get to the end anyway, just to promote the MMR. It's offered by GPs, and just to remind people that there's no upper age limit to receive it. If people are unsure if they've got it, there's no harm in getting an additional vaccine. And these are some helpful links, in addition to the links that were peppered throughout the slides, if anyone wants to refer to them. Thank you.